All right, so anaphylaxis, anaphylactic reaction. A little bit hard to read. Let me turn some lights off. So you're going to a park for a 25-year-old male complaining of difficulty breathing. At 7:14 in the morning. At least it's after 7, because right at 7 is shift change, so if this had been 6:55, the night crew would have been upset. Now, 7:15 is your responsibility. So if you're going to this, what are some things that you're thinking it could be?
Asthma.
Okay, I have a 25-year-old, so that's a little piece of information.
Yeah.
So asthma, I would think at that age would be an appropriate possibility.
You wouldn't think smoking or anything like that since they're that young.
Well, they may be a smoker, but you're right, I don't expect there to be emphysema or chronic bronchitis from a life of smoking at the age of 25. So those are not high on my list. But he could have some sort of infection, so just regular bronchitis, acute bronchitis, or pneumonia is a possibility.
Have an airway block.
Okay, maybe choke on something.
What about a pneumothorax?
Pneumothorax, definitely, because we talked about that younger male, especially if they're thin, kind of the classic for spontaneous pneumo. Good. Now, anaphylaxis should have been on your list because that's the chapter we're covering. But I'm glad you said all these other things because I think that's important that we don't anchor on one particular diagnosis or one particular condition. We keep our minds open until we get more information. Because right now I sort of have a whole lot of information. There's one thing that worries me a little bit, is if the police department is already on scene, what made dispatch worried enough that they sent police first?
He could have been shot.
Yeah, I'm starting to think that this was maybe like a welfare check, or he was acting odd, and the police got there, and then they realized they needed EMS and called us. So anytime you hear that the police are already on scene, it usually means they've been there, they've been talking to the person, and they think something's off and that the EMS was needed. So whenever I hear that from dispatch, I'm always just a little more anxious, a little more nervous about my scene safety. So on arrival, no hazards. Looks pretty safe, no trauma, don't see any bleeding or anything. You see the patient sitting up, kind of leaning forward. What do we call that position? Tripod position. And he's gasping. His name is John Freeman, and I feel real bad. So if they're talking like that, what sort of degree of respiratory distress is that? Mild, moderate, or severe? That's moderate to severe. They can only speak in 1 or 2 word sentences. So that should be like, ooh, this is bad. Now, just from this, what do you want to do for this patient? Give him oxygen. Good. He's having a hard time breathing. Pretty hard time breathing. He can only say a word or 2 at a time. He needs oxygen. I don't know what's wrong with him yet, but I know we need oxygen. We just do have to continue with our assessment, though. So, anything else that we're going to do for this patient? Okay. Well, all we've kind of done right now is our patient assessment triangle. So as I get closer, I want to make sure airway clear, breathing, count that, their pulse. Yeah, and then at the end of that, vital sign. No little B went across the screen, so you got to make sure the scene's safe. That is a concern with anaphylaxis. So with an anaphylactic reaction, what happens is somebody gets exposed to something. And this could be anything, theoretically. And the first time you get exposed to something, your body looks at it and says, is this Todd or is this not Todd? So all of the cells in my body have little T's on them to identify them as Todd. So I take something that is not me, they don't really have little T's, but they have the histocompatibility locus. So there's stuff on your cells that say it's you. So when you take something in your body that's not you, your body can recognize that. Now most of the time, the stuff we eat isn't a big deal, the stuff we breathe in isn't a big deal, but sometimes our immune system just goes haywire with it. So I take in something that is not me, and my immune system will attack it and try to destroy it, and that's the immune response. That's what fights off colds and flus and infections and all the rest of the stuff. So that's normal. But if you eat peanuts, your body should not have any sort of reaction. It should say, hey, that's just food, yum. But sometimes there's an immune response. And antibodies are given off, and antibodies are important in anaphylaxis because they're part of the whole reaction. So some of the cells in the body and some of the antibodies end up being memories. So the second time you get exposed to something, your immune system can respond much faster and much stronger. So the first time it may take it a few days to kind of kick in and start fighting off something, but the second time it sees it, it can do it very quickly. It's kind of how immunizations work. We give you something that is either dead or looks like the virus, and then your immune system says, hey, that's not supposed to be here. It mounts a defense and destroys it, and then keeps a memory of it. So the second time you get exposed to it, it kills it off before it ever makes you sick. Now, allergens is just a chemical. Might just be a little protein, it could be something bigger, but this is something that's going to cause an allergic reaction in your body. And I want you to understand that there are different levels of allergies, from type 1 to type 4. So mild allergies, you're going to have the watery eyes and runny nose, coughing, sneezing, just feeling bad, that sort of stuff, red eyes. We all have that down here in Alabama, especially in the south, especially in the summer or spring. A little bit in the fall, especially when it had rain in a month. So you go outside now, you may feel a little congestion, eyes may feel kind of scratchy. Those are mild allergies, not a problem we can take our normal stuff for. But some people have a severe form of this, and that's the anaphylactic reaction. So allergic reaction versus an anaphylactic reaction. Allergic reaction's not that big of a deal, but the anaphylactic reaction will kill you, potentially. Actually kills a lot of people every year. So it's something to worry about. And we usually use the term anaphylaxis with it, but it means about the same thing. So sensitization is that first time we kind of get exposed to it, and our immune system's ready to go, sort of in a little bit of an overdrive there. So hypersensitivity means that when we get exposed to this again, our immune system overreacts. And one of the ways it overreacts is it will try to move blood and fluid basically everywhere in the body to try to capture whatever that foreign substance is and flush it out of you. So you have all these welts and wheals that develop on you. And a lot of this is caused by one of the antibodies, IgE, combining with a mast cell and releasing histamine, which I'm sure you've heard of, because you've probably had antihistamines. And histamine is what tends to cause a lot of the blood vessels to become leaky, and blood vessels to dilate, and the tearing, and the watery eyes, and all that fun stuff that we get with allergies. That's usually due to histamine. So the original antihistamine was Benadryl, but the problem with Benadryl is it also makes us sleepy. So then we try to come up with histamine 2 blockers, things like Tagamet and Pepsid, that won't make you sleepy, but still fight off some of the signs of symptoms, Claritin and all those. They still make me very sleepy. Zyrtec, I think I can take without being totally zonked, but Claritin Clear, that doesn't work for me. I'm Claritin Z's. I'm total flawed with it. And then some people do stuff really dumb like this. So this was the thing for a while, probably still is the thing for a while, where you have really, really bad allergies or you have some sort of autoimmune disorder. So you go into a place and let bees sting you hundreds of times. So I had to throw that in there when I saw this. Anybody ever heard of the Darwin Awards? It's a somewhat scientific, somewhat medical thing, but it's really a spoof. They put it out every year. They find people that really did dumb things and usually died. And I don't want to say they make fun of it, but we make fun of it. One of the first time they put it out was there was a guy in a very high office building that was told the glass windows were so strong you could throw yourself against them So from like the 25th, 26th floor, he ran across the office and threw himself at the window and found out that that wasn't true. Now most of us would be like, okay, if the windows are that strong, that's cool. I'm not gonna test it.
Try with a chair.
Or throw a
Or
chair.
chair or something.
I don't think I throw my body in it.
Yes. So we call them the Darwin Award because Darwin and evolution, if these people don't ever reproduce, then theoretically, the human race should get smarter because these people are being weeded out. It is terrible. It is really terrible. But at some point, you go get stung hundreds of times to help fight off whatever you have. I hope she hadn't reproduced a whole lot. So anyways, so those are all anaphylactic reactions. And then there's a thing called an anaphylactoid. And this was something that when I went through medic school, EMT school, they didn't really mention or wasn't something that was out there. But there are some things, and aspirin is one of them, that the very first time you take it, you have an anaphylactic reaction. Now this is pretty rare, but some people just have this in their system. They're already pre-primed that as soon as they take it, they start to have an anaphylactic reaction. They've never been exposed to it before. In theory, that shouldn't happen because an anaphylactic reaction with your immune system requires the exposure and sensitization first, and then it's a hypersensitivity reaction. Anaphylactoid, though, the first time you take it, swell up, airway swells shut, can't breathe, wheezing. And this is what scares me a little bit, because if you've never been exposed to it before, you wouldn't know to have an EpiPen. So you don't have that. Although things like wasps and bees, you get stung once. Theoretically, any time after that, you could have an anaphylactic reaction. So you get stung once, okay, your immune system's primed and ready. You get stung by the same type of wasp the second time. Oh, I didn't have one. Good. Third time, you could. Fifth time, you could. 12th time, you could. You don't know. So there's always that possibility out there. Although in general, if you've been stung by something 2 or 3 times and you haven't reacted, it doesn't seem like your body's going to. But theoretically, anytime after the first one, it could. So what happens with these anaphylaxis reactions? So there's 4 ways to get things in the body. We can inject something like it stings you, or you get a penicillin shot. Antibiotics are notorious for that too. You eat something, ingest it. And these are things like peanut butter and strawberries and chocolate, which would, I'd just go ahead and die. But those things you're not supposed to take. They have shellfish is another common one. You may inhale something. You could breathe in a chemical. Or you can get chemical on your skin, and then it gets absorbed through your skin. So these are the 4 ways we get something in our body. And an anaphylactic reaction tries to fight all 4 of these. So it's going to open up all your blood vessels at once to try to run more blood and more white blood cells to everywhere in your body when you get injected. Although theoretically it should only go to the injection site. So if you've ever been stung by a bee, you notice that it probably turns red, swells up. That's what it's supposed to do. But in this case, your immune system's gone haywire, and it just dilates everything in the body. So now your whole skin becomes flushed. Sometimes you also get cool and clammy, because if we dilate all of our blood vessels at once, what does that do to our blood pressure? All of our blood vessels are normally here, now they're here. It's going to drop the blood pressure. Anaphylactic shock. Now, how about ingestion? If you take something into you really shouldn't eat. What if your dog eats something it's not supposed to eat? What does it do? Throws it back up. So if you eat something and your body says this is bad, we need to get rid of it, you can puke. So vomiting is a sign of anaphylaxis. And sometimes just evacuating everything out of your system. So diarrhea and terrible abdominal pain or abdominal cramping are also signs of anaphylaxis. Now inhalation. How can your body keep you from inhaling anything? Yeah, just swell up the airway, not a problem. Causes bronchial constriction, so you have terrible wheezing, tongue, lips, throat, all swell. You can't breathe in any more of that bad stuff. You're not breathing in any oxygen either, that's a problem. But your immune system doesn't care about that. It just wants to make sure that you're not getting any more of this allergen stuff in. Now skin contact, kind of the same thing with injection. It's going to dilate blood vessels to the skin, So that's where the whelps and the wheals and whatever else you want to call it, hives, urticaria, all that stuff comes in. So we're assessing these patients. We of course need to make sure that the scene is safe. So if the patient got stung by something, they might still be around. Now generally it's not a huge issue. My last bad with this was this summer, went to open up the umbrella over the picnic table, and it had been closed for a while, so I stuck my hand in there to open it up, and apparently a wasp's nest had set up in there, and a decent sized one, because I got hit like 8 times before I could jump in the pool, and I was only about 5 feet from the pool, but my arm was all swollen up. It was not fun. I didn't have an anaphylactic reaction thing. But if somebody has that and there's still a bunch of bees or wasps buzzing around, you may have to like step back and not get out of the ambulance. Now you can call the fire department, because they have this thing called a fog pattern on their hoses, where it makes all these fine droplets in this very wide sort of wall of water. And they can maybe approach the patient with that in front of them and or push the bees away. And then you can grab the patient, run inside the ambulance real quickly. If you see things like EpiPens on scene or Benadryl, you can suspect that they have an anaphylactic reaction. So that's something else we can look for on scene. But make sure it's safe. Most of the time it's going to be safe. So this poor lady, she gets used in slides all the time. You go onto Google and image her, and this is one of the free ones that you can use. That is a problem. That tongue is swollen, really swollen. So you see that, and you have to think airway issue, right? Because I don't even see what's going on in the back of her tongue, the back of her throat, because all that's probably swollen too. And what sound would I expect to hear if I heard her breathing? Well, if I listen to her lungs, I hear wheezing. Well, what airway sound? I don't think I heard somebody say strident. Because her airway is probably about that big around right now. So she's getting just a little bit of air in and out. You're not going to stick oral airways in this patient. You're not going to stick nasal airways in this patient. You're worried about making the swelling worse. Really, there's nothing you can do to the airway at this point other than go, oh, this is bad. Let's go fast. Now, if she has an EpiPen, she needs it now. Like now, immediately. Actually, she needed it about 15, 20 minutes ago, but since she didn't do it then, she needs it now. If she did it 15, 20 minutes ago, she needs another one now. Because that can continue to swell and swell completely shut, and then you need to go to the closest hospital where they can cry her, put her tube in through her throat. In addition, because of the shock, she may have weak rapid pulse, cool clammy skin, maybe dizzy, weak, and all that from the shock. Urticaria is just the hives. Usually they start around the abdomen and then they spread from there. So if somebody was exposed to something, you've got to lift the shirt, look across their belly, lower back to see if you see hives developing. And hives don't necessarily mean anaphylaxis, but if I'm having that bad of an allergic reaction, anaphylaxis might be next. So something to watch for. And when I do that, I want to look for nasal congestion, runny nose, stridor, tightness in the throat, scratchy throat, difficulty speaking. They might sound hoarse, wheezing, tachycardia, hives. When you get to the GI stuff, that vomiting and diarrhea and abdominal cramping, that was not something we used to think it was all that common, but I think it's fairly common in anaphylaxis. Don't be surprised if they've had some problems with the bathroom issues. Fire ants do that to me. I don't swell up, I don't have facial swelling, but I get nailed by a fire ant, I'll be spending the next 2 hours on toilet. One end to the other. Eat those little boogers. I told you about my first exposure to those, didn't I? Coming down from Wisconsin, we didn't have fire ants up there. I didn't know what it was, so I moved, living in Atlanta. And everyone's like, oh, you gotta watch out for fire ants if you don't know what they are. I'm like, I don't know what they are. Oh, you'll know, you see the big mounds in the grass. Okay, how bad can that be? So, outside my apartment one day, there's a big mound. I'm like, hey, I bet that's fire ants. Let me poke at it and see what these things look like. I'm like, oh, they look little. Oh, there's one on my finger. Holy! I understand now why they said, Don't play with fire ants. I probably should throw myself against a glass window from a high story too.
The 25 sounds good.
Yeah. So now when you get into your secondary assessment, of course we're giving them oxygen because they're having all that airway swelling, and whatever little bit of air is moving in and out, we want to give as much oxygen as we can. Note that we have the pulse ox, but if I see that much swelling like we saw in the previous slides, I'm going to give them oxygen anyways. I'm not going to worry too much about the pulse ox. I'm going to put it on there just so I get some numbers and I can see some trends. Sample history, I really want to know what are they allergic to, and do you have an EpiPen? Is that part of your medication? Now, as part of the last oral intake, I want to ask if they've taken anything. Because a lot of times they say, oh, I took some Benadryl, or I took some Tagamet, or I took some Claritin. I'm like, great, you took it orally, great. In an hour or so, you will not itch so badly. If you're still alive, where's your EpiPen? So, all these antihistamines supplement things, but the epi is what they need. They need the epi. That's for anaphylaxis. Now, allergies, Claritin, Zyrtec, Benadryl, all this stuff works great. Gets rid of your water, your eyes, your itchiness, your scratchy, all that. Cool. But facial swelling, signs of shock, abdominal problems, you need the EpiPen. So get your vital signs, and I would expect their heart rate to be up, their respiratory rate to be up, blood pressure to be down. Normally there's not a whole lot of suctioning you have to do to the airway, but they might not be able to swallow, so there might be saliva and things coming out of them. But definitely give them oxygen. If they're not breathing, or if the rate's too low, or if it's too shallow, we're going to bag them. And then at that point, the auto injector epi. Now I carry the same medicine on the ambulance as a paramedic, so if it's not available, or if you've given it once and they're not better in about 5 to 10 minutes, we need to give a second dose. Make sure you got ALS coming, and we'll give them a second dose of it. Now, in addition, if they have Benadryl or Claritin or Tagamet and they wanted to take that, fine. That's going to keep them from itching so badly while the rest of the stuff works. If they have an inhaler, remember there's some wheezing that goes on with this too, bronchoconstriction. They can try their inhaler. It's not going to hurt things. It's only going to help, but that's not going to be what fixes the anaphylactic reaction. They need their epi. Ask them if they've ever had a reaction that's bad before. Ask them if they've ever been intubated. Ask them if they've ever been hospitalized for these allergic reactions. Ask them what happened the last time. How quickly did it happen? Because generally, the faster the reaction, the worse it's going to be. That's not 100%, but generally, the faster the worse it's going to be. And then after you've given your epi, make sure you reassess their vital signs and their air breathing circulation again. And if it's not getting better in 5 to 10 minutes, I need a second dose. Rarely is a patient going to have a second dose. Most of the time, it's just going to be the one. So remember that this adrenaline is going to cause vasoconstriction, bronchodilation, tachycardia. So this is almost the opposite of what is happening in an anaphylactic reaction. Because anaphylactic reactions cause bronchoconstriction and vasodilation. Epinephrine causes the opposite. So it's a pretty good counter to it. Normally you get 5 to 10 minutes for it to work. Remember the difference in the adult and the pediatric doses? How much is in an adult EpiPen? You're going back to pharmacology and fail, all of you. You obviously have not been flipping through your drug cards recently. Adult dose is 0.3 milligrams. The pediatric dose is 0.15. And usually about 8 years old is the switch from peds to adult. Some places will say less than that. It's really up to their physician. And remember to pull the blue safety off, put the orange part against their thigh, and inject it into the big muscle. Can go through clothing. If you haven't had a chance to watch the little video, I think it's in the pharmacology soft talk, where I stab a cardboard box with an EpiPen. Some of you are like, you saw that? Really? Some of you are like, I gotta go back and watch that one. You can just YouTube and it's on there. And I'm not the only one that did it. I'm just one we did it. So following up on the guy that we went to the scene, so we're at the park and we noticed he's in jogging clothes. So he's one of those. Was up at 7:15 in the morning, go for a run. So, however, you see hives over his face and neck. That's a concern. scratching his arms and legs, speaking only 1 or 2 word phrases, as we saw earlier, and you hear stridor, and you can even hear the wheezing without the stethoscope. That's what audible wheezes means. You can hear the wheezing without having to use a stethoscope. That usually means it's bad wheezing. So, lots of airway problems here, right? Breathing problems. So, you get some vital signs. This is what you get. And we didn't wait to see what the pulse ox rating was. We saw it from earlier, it was only 1 or 2 word sentences, and immediately put them on the non-rebreather. Is that about what you expected? Not too bad. Pulse rate's pretty high, but if we're going into shock, anaphylactic shock, then that's to be expected. Heart's trying to compensate. All right, so that first bullet point, felt a sting 3 minutes later. That's fast for an anaphylactic reaction. So in my mind, this is the red flag. If he had said 30 minutes later, I'm like, it's not as bad. Now, anaphylaxis they now say, happened up to 48 hours. It used to be 30 minutes if you didn't have a reaction, we kind of felt you were safe. But they're now saying that there are people that have reactions up to 48 hours after being exposed. But here's your blood pressure, 82/50. And even with the oxygen, your pulse ox is still showing 88. So can I really crank my non-rebreather up higher than 15? Not really. Now there is a possibility here of thinking about CPAP. Although CPAP, they don't want us to use if the patient's in shock because it can make the blood pressure go down a little bit more. So with the blood pressure 82/50, that's probably contraindicated. Not all sources will say that shock is, but in Alabama, our protocols say that if we think they're in shock, we're not to use CPAP. Fortunately, he just happened to have an auto injector, and you need going through your drug rights. Remember your 6 hours, 6 rights. One of the things is the right date, and it is not expired. Now, we don't have to call medical direction. We have it per protocol. But remember, if we're going to give a medication, it has to be either per protocol or per medical direction. So we administer it. Where do you give it? In the thigh. Good. Good. We leave him sitting up, keep the high flow O2 going, and begin taking him to the hospital. And a couple minutes later, everything looks good. Now you're talking about saves earlier. This is the save. Now part of me wants to dope slap him. Because why did you wait for us to show up to give yourself the EpiPen?
Obviously you needed it because you had it with you on the job.
Yeah, so he knew about it. He just hadn't given it yet. So after you realize it's going to be okay, dope slap him and say, next time just use it right away. I wouldn't go back in service until after I had breakfast. 7:15 in the morning, and we've got to eat. So get restocked. Now, I made a little joke about dope slapping him for not using his epi right away, but that is something that we see a lot. Is people are very hesitant to use their EpiPen. They just don't know if it's going to get bad enough. Is it really bad enough that they should think about using it? I know it's really expensive, so I don't know if I want to use it, if I don't have to. Maybe I just want to let the EMS crew come check them out and see if I need to use it. And what we find is those patients that wait on using epi and medics that wait on administering it, even in the emergency department, if the doc's like, his throat's just a little scratchy, I think we're okay, they wait, those are the patients that die from it. So if you think anaphylaxis, give me epi. If something makes you think, hey, this is anaphylaxis, give me epi, don't wait. The worst you're gonna do is make them tachycardic, and you make them really excited, because it's a good adrenaline rush. That's the worst you can do. The best you can do is save a life. So it's one of those, there's not a whole lot of risk. Now, somebody that has severe cardiovascular disease, it could cause a heart attack. So in those situations, there is some concern. But if the doctor felt that giving them an EpiPen prescription was good, then you should probably use it to help them with it. So don't hesitate to use the EpiPen.